Let's see. First post was this one. I know your health system isn't targeted for ransomware attack, but humor me. Can I see your cyber response plan? And the reason I posted that is there's a lot of health systems that believe that anonymity is my barrier, that we're such a small health system that they're not coming after us. But that's really been dispelled at this point, hasn't it?
It's interesting. So, in July, we published at CI Security, we published the 2020 healthcare breach report, and we went through the HHS wall of shame, and we did a whole bunch of analytics on that data. And it was kind of interesting. We took a 2-year period, we broke it down into 6-month segments, and oddly enough, in the first half of 2020, the number of reports were down by 10%, and the number of individuals affected, meaning the number of records breached, was down 83% over the previous period. And it was a real head scratcher, right? Because why? So we went through a bunch of stuff like, well, maybe cybersecurity's just gotten better. And, but what we ultimately kind of concluded was the first half of 2020 was super distracting. And there were a whole bunch of things that health systems did to make exceptions to their cybersecurity rules and their operational rules, because they brought in new equipment and added, folks who were travelers to come in and support them. And they changed roles for people in the EHR to be able to have more access because they were using people in different places, and they stood up new points of service. And the list goes on and on and on. Telemedicine, sent people to work from home. So there was a lot of distraction in the first half of 2020. So in that report, I predicted that the second half of 2020 was probably going to be terrible. And part of the reason for that was that organizations were probably already breached in the first half of 2020 and just didn't know it yet. And that really turned out to be the case with like UHS and Blackbaud and, other things that sort of have revealed themselves so far. And then you have this happening on top of it. So your point about have you done the stuff that you should do for cyber response, for incident response? If I was a healthcare executive and not the IT, not the CIO, not somebody in that chain of command, I was a chief operating officer. That's exactly the kind of thing I would be asking for. Let's sit down and talk about our incident response. How does that work? Do we have a plan? Have we exercised it? Who should be involved? Do we have the phone numbers for the FBI? Do we have all those things that we need? Because it really is now, not if you're going to be breached, but when you're going to be breached.